Today is the return of the dog line. Hi guys, so here I am back with Carmelina. Some of you might recognize her from one of our previous videos.
Hi.
So Carmelina is 51 now. I know some of you people at home wanted to know how old the models were, so there we are. And why don't you tell us a little bit about which areas it is that you're looking to improve?
Well, basically my dog lines, as I call them now. I now think you call them that as well.
I did, yeah.
Yeah. And where my eyebrows are, in between there, I've got a few wrinkles there, and my lips, of course, which I loved last time,
Brilliant.
and my tear troughs.
Excellent.
I really enjoyed that last time.
We did some treatment underneath the eye, didn't we?
Yes.
We did a bit of PRP there.
Yeah.
Which seemed to work really well, looking at the before and afters. And that was just one session.
I know.
So, normally when I'm doing it in the clinic, we do 3 sessions. So that was brilliant, I thought.
Yeah.
And then in terms of the lip, tell me about that. Is it more for little vertical lines?
Yes.
Okay.
Yeah, I do like, because I tend to find that I have got the little lines with the age,
Yeah.
with the dog lines. They all seem to be lines. Yeah. So, yeah, I'd like to get rid of those and, feel a bit more youthful.
Have you seen your video from last time?
Yes.
Did you watch it?
Yes, I did watch it last time. I was like, oh, wow. It was a bit of a shock to the system. I never realised. But, yeah, it was a bit of a... But I did like the after effect.
Did anybody notice?
Yes, a lot of people noticed. They were like, wow, it's not a great big shock to the system, but it was nice. It was just like, oh, wow.
Yeah.
What have you done? You
Yeah.
know? And yeah.
I guess that's what you want, really.
Yeah.
I was really pleased with your results.
Yeah.
I thought they looked lovely.
Yeah.
And your skin looked really nice as well afterwards.
And that's what I found, that that as well as the... What was it? The
the Profilo, the
Yes.
Injectable Moisturiser.
I did like that as well. Yeah.
Well, we'll definitely do a bit more of that, eh?
Yeah.
Yeah, I've got to say though, looking good. Looking
Yeah.
really good. So let me just get the iPad.
Okay.
It was kind of this area here, wasn't it?
Yeah.
Around the eye that we were looking to improve. Do you know what? I think your skin is probably good enough now to be able to put a bit of filler there, maybe. I bet you could.
Okay.
And we can always overlay that with a bit of PRP as well around there.
Okay.
These are easy to treat, we
Yeah.
just pop a little bit of Botox in there. And yeah, I think your lip looks really nice there. Really soft still.
Yeah.
But why not? I mean, you can always make an improvement.
Well.
Why not? I think for you, most of the action actually is when you're smiling. So I'm just going to grab a picture of you smiling. Where are you? You can see a lot more of the little lines there, can't you?
Yeah, definitely.
But do you know what's so great actually about you though is when you're smiling, your face goes into much more of a V shape like this, which means that you're pretty easy to treat when it comes to using fillers.
Oh, wow.
So some people, when they smile, they don't look better. Some people blossom when they smile, and
Right.
you do, and then that means it's quite easy to treat you. So the reason behind that is because when we do dermal filler injections, we tend to focus quite a lot in this area here and here to restore volume. So when somebody's smiling, it's kind of mimicking what they would look like if they had dermal filler injections.
Oh, right.
So if somebody looks better when they're smiling, you know that when you do the filler, it's going to look good. If they look worse when they're smiling, now that's much more of a challenge. But you're not a challenge.
Okay, thank you.
So I do think, we can pop a little bit more in there as well.
Yeah.
They're definitely not as...
Bad as they were.
No,
the first time round they were like really...
Yeah, they were in there, weren't they?
Yeah, they were definitely in there. But no, I do.
And then I was kind of thinking as well, maybe the neck, for these little lines here might be quite nice. We could maybe do something there, bit of skin tightening treatment. Let's just have a quick look at you from the side as well.
Can I just say, as well as that, when you're actually putting makeup on, it's much easier as well.
It's easier, yeah.
It doesn't actually sit in.
You doesn't get stuck.
Yeah, definitely. Does get stuck, I know, definitely.
So this here, that bit of a jowl, I think if we do some more injections back here, and then in this sort of area here, that should give you some lifting, and hopefully straighten that out as much as possible. So if this bit of jowling is still there when we've done the rest of the treatment, maybe if you came back a third time, we could even look at doing some fat dissolving injections in there.
Definitely.
Which might be quite nice. But there's everything to play for.
Okay, yeah, that sounds really,
highly excellent.
Excellent.
So do you have any concerns about the treatment? I know you've done it before, so is there anything that you're thinking, oh, I'm a bit worried about that?
The bruising. That's the only thing.
Was it bad last time? Where did you bruise?
Around my eyes. But I mean, it wasn't for long because thank God for makeup. But,
yeah.
I mean, the results after, it's worth it. But I was a bit,
Yeah.
But no, apart from that.
Well, we always say, no alcohol for a couple of days beforehand, stay off the aspirin and ibuprofen.
Okay.
If you take garlic or ginkgo or vitamin E supplements, then lay off them as well if you can beforehand. But I'm sure you were doing all those things before.
Yeah.
Often, actually, you find the second time that somebody does a treatment, the bruising isn't as bad.
Oh, that's good.
Because the skin's a bit thicker. So you might not find it's quite as bad as it was before.
Oh, okay, that's good.
Okay, so let's go ahead and do it. So we're going to start with the classics. That is, of course, botulinum toxin to the glabella, the forehead, the bunny lines, DAO, the crow's feet, and the mentalis. Chop, 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 chop. We're switching over now to using Juvederm 4, and I'm injecting 1 ml per side in the temples. Juvederm Volux now, which some of you guys might not have because it's relatively new over here. They definitely won't have it in the States at this point. And I'm using that in the cheek area, along the cheekbone, 1 ml per side. The Juvederm Volux again for the angle of the jaw. We're doing that with a cannula, 1 ml per side. Now we're going to be doing the underside of the chin, and we're using 0.5 ml per side of the Juvederm Volux. And up until this point, we have used 7 ml of product. I'm using Juvederm Voluma now, 0.5 ml per side, by doing very, very small, tiny injection points in front of the ear, and that's for lifting. Now Juvederm Volux, 0.5 ml per side in each front part of the cheek. This is for a bit more projection here. And then Juvederm Volux again, 0.5 ml per side in what she affectionately calls her dog lines. And we're taking that all the way from the end of the line up into the base of the nose. Now using Juvederm Voluma actually in the marionette line, 0.5 ml per side, we're treating the whole length of the marionette line. Up until now, we've used 11 ml of product. How high can we go? I've weirdly switched over to Restylane Finesse for the eyebrow, and I'm doing 0.5 ml per side because why not? And then using Juvederm Volite in the necklace lines. This is a hydrating product. It's not really a filler as such. I guess you could call it a skin booster or part of the injectable glow treatment. Now I'm using Restylane 0.5 ml in the lip, just doing the border of the upper and lower lip. And I personally like to just treat the lower middle third quite often rather than doing the whole of the lower lip, because sometimes that can make it look a little bit like a slug. Now we're using Redensity 2, this time with a needle underneath the eye, and I had a little bit left over, so I'm just popping it in the fine lines around her mouth now. And we've used a total of 14.5 mils of filler. The last treatment we're going to do for Carmelina today is some PRP under the eyes. As you know, personally, I like to just take the PRP and inject the vast majority of it in the area that I'm treating. That's what we've done right here. Okay guys, here we are back today with Carmelina. Hello.
Hi.
Nice to see you back.
Thank you.
Looking lovely.
Thank you for having me
If I may
back.
say so. So tell me, how did it go?
Perfect. I mean,
Yeah.
I'm loving it so much. I mean, like actually applying my makeup on it it's just so much easier.
Yeah.
And like, yeah, it just amazing.
You look stunning. I have to say. I'm
Thank
really
you.
pleased, really pleased. Was there anything in particular that you thought, oh yeah, that treatment was amazing for me?
The under the eyes, this area here, even applying my makeup actually just sits better, and well, up the top here. Well, there isn't anything that I don't like about it. Everything just went well.
Your lips look lovely.
Yeah, and my lips, I've had so many compliments.
Yeah.
And like, I know, but I actually felt that my lips were like, as soon as I had them done, it was just like everyone goes, wow, your lips. I go, yeah. Everyone was like, your lips. I go, yeah.
Really nice.
Yeah, so I really did like it.
Tell us about the downtime. Be honest about the downtime. Were you swollen, bruised?
I was swollen, I must say, for about a week. But after, like, the day after, yeah, of course you're going to get the swelling and whatever. But it slowly, but very fast, went down. The third, the fourth day, I wasn't bruised as much. But no, I just, yeah, it just...
So we've had you on the channel before, and do you think that there was less swelling and bruising this time, or was it about the same? There is no right or wrong answer here.
No. I think the first time I did have more bruising.
Yeah.
But the second time round, no. I can actually count on one, like just 2 little bruising, and that was that. 2 little bits.
You had quite a bit of treatment both times, and guys, I think that's because when people have treatment, it kind of improves your collagen in that area. So think about it, as you get older, older people are more prone for, if they bruise, the blood will kind of seep out into the surrounding tissues because the skin's not very strong. But when you have fillers, it makes your skin a little bit stronger. So even if you do get a small bruise, it doesn't turn into a massive shiner or anything like that, the more that you have treatment. So that's why I was just asking about her experience there. So is there anything that you would like totally keep up and keep doing?
Definitely the dog lines. And of course, the dog lines, of course. Oh, right, okay. And there's no more there now. And the forehead. Yeah. And yeah, definitely under the eyes. That makes a big difference. Yeah. Yeah, and the filler here was, well, yeah, everything.
You must have got some comments because you do look really good.
Oh, yeah. It does. I mean, the week after I went to a wedding and everyone was like, wow. And that's all I can say is with a big capital W, it was just wow, wow. And they go, you just look amazing. Wow. Yeah, you're great. Saying it now.
I know, right?
Wow. Yeah.
Perfect. Yeah, you do. You look good. Okay, guys, thanks so much for watching the video, and thank you so much for coming back in.
Thank you.
It's a pleasure to have you back.
Thanks for having it done.
So if you do have any comments, questions, anything like that, let us know in the down section below, and I will see you guys in a couple of weeks. See you later.
Bye.